Greetings, dear viewers, especially our senior audience and their loved ones watching today, and we're here to delve into a profoundly important and sensitive topic, stroke. This is a medical emergency that can change a life in an instant, but with the right knowledge, we can make an immense difference, a difference that can save lives and significantly improve the quality of life thereafter. Did you know that stroke is the fifth leading cause of death and the primary cause of long-term disability in the United States? This statistic is particularly alarming among older adults. When we talk about stroke, we're discussing a condition that impacts millions of families, presenting significant physical, emotional, and financial challenges. For us, and for those we cherish, understanding stroke isn't just a good idea. It is absolutely essential knowledge to protect ourselves and our communities. Our main focus today is what to do in the first 10 minutes when a stroke occurs. 10 minutes. It sounds like a fleeting moment, but this incredibly critical time frame can dictate the ultimate outcome for someone experiencing a stroke. With every passing minute, millions of brain cells die, taking with them the ability to think, remember, move, and feel. Therefore, a swift and accurate response is key to saving a life, minimizing brain damage, and vastly improving the chances of recovery. We will delve into specific actions, crucial things to avoid, and essential background knowledge about stroke, so you can feel confident facing this emergency. Before we dive into the specifics, I must emphasize that the information in this video is provided for general educational purposes only and is not a substitute for professional medical advice. It is not intended as a diagnosis or a personal medical treatment guide. If you or a loved one experience any stroke symptoms, please call 911 immediately. This is a medical emergency that requires the urgent intervention of trained healthcare professionals. Your safety and well-being are our top priority. Why the first 10 minutes are so crucial. The time is brain. Principle. Let's begin by understanding why the element of time is so critical in the event of a stroke. In medicine, we live by the saying, time is brain. This isn't merely a catchy slogan. It's a grim biological reality that everyone needs to comprehend fully. When a stroke occurs, the blood supply to a part of the brain is interrupted. This can happen because a blood clot blocks an artery, starving brain cells of the oxygen and vital nutrients they need to survive. Or less commonly, it can occur when a blood vessel in the brain ruptures, causing bleeding into or around the brain, which then creates pressure and damages surrounding brain cells. Regardless of the type of stroke, the outcome is the same: damage and death of brain cells. Scientific research has estimated that for every minute that passes after a stroke, approximately 1.9 million neurons, 14 billion synapses, and 7.5 miles of myelinated fiber are lost. Imagine that number: nearly 2 million brain cells vanishing every single minute. This loss doesn't just affect movement or speech, it also impacts the ability to think, remember, feel emotions, and perform countless other essential bodily and mental functions. The extent of brain damage directly determines the degree of disability and the patient's potential for recovery. Fortunately, modern medicine has developed highly effective stroke treatments that can limit brain damage and significantly improve outcomes. However, the crucial point is that these treatments operate within a very narrow time window to be most effective. For instance, tissue plasminogen activator, commonly known as TPA, is a powerful clot-busting drug used for ischemic strokes. But for it to be safely and effectively administered, TPA must be given within 3 to 4.5 hours of symptom onset. If administered beyond this time frame, the risk of brain bleeding as a side effect of the drug increases significantly, posing a severe danger to the patient. In certain cases, particularly when a large blood clot is present in a major brain artery, doctors can perform a procedure called mechanical thrombectomy. This procedure can be performed within a slightly wider time window, typically up to 6 hours, and in very select cases, even up to 24 hours. But the golden rule remains: the sooner the better. Every minute of delay reduces the likelihood that the patient will qualify for these life-saving treatments, and more importantly, it diminishes the potential for a good recovery. Getting the patient to the hospital as quickly as possible means they have a much higher chance of receiving these interventions, which significantly boosts their chances of full recovery or minimal disability. That's why those first 10 minutes are absolutely vital. They are the time to recognize, react, and initiate the life-saving process. Recognizing stroke signs. Using the FAST acronym. Now let's move on to the most critical part, how to recognize if someone is having a stroke. Early identification is the first and most crucial step in the chain of survival. The American Stroke Association and the American Heart Association have created an easy-to-remember tool, summarized by the acronym FAST. This is a life-saving tool that all of us, especially older adults and caregivers, need to commit to memory. Learning FAST could be the most important thing you learn today. Let's break down each letter in FAST, and I'll guide you on how to quickly check for each sign. F stands for face drooping. This is the first sign you need to look for. Ask the person to smile. Observe their face closely. Does one side of their face or mouth droop or feel numb? Do you notice any asymmetry? Normally, when a person smiles, both sides of their face move evenly and symmetrically. If one side sags or doesn't move, it's a strong warning sign. A stands for arm weakness. Next, ask the person to raise both arms overhead simultaneously. Does one arm drift downward, or do they experience weakness or numbness in one arm? Do they have difficulty holding both arms at the same level? A stroke often affects one side of the body, and this will become evident when they try to lift both arms. One arm might slowly drop without them being able to control it. S stands for speech difficulty. After checking the face and arms, assess their speech. Ask the person to repeat a simple, clear sentence. For example, "The sky is blue today," or "How are you feeling?" Is their speech slurred, garbled, or difficult to understand? Do they struggle to find words or understand what you are saying? Sometimes they may not be able to speak at all, or their speech might be completely nonsensical. T stands for time to call 911. If you observe any of these signs, even if they are mild or transient, even if you are unsure, then it is time to act immediately. Do not wait to see if the symptoms disappear on their own. Do not assume they are just tired or sleepy. Every second counts. Call 911 immediately. This is the single most important message of this entire program. It's crucial to remember that a person experiencing a stroke may not recognize their own symptoms. They might be confused, paralyzed, or unable to communicate. Therefore, the responsibility for recognition often falls on family members, friends, or caregivers around them. Always be vigilant and never hesitate to act if you suspect a stroke. In addition to the FAST symptoms, there are other signs that could indicate a stroke, though they are less common but still very important to recognize. These include sudden numbness or weakness, usually on one side of the body. Sudden vision problems, which could manifest as blurred vision, double vision, or loss of vision in one or both eyes. A sudden severe headache with no known cause, often accompanied by vomiting or altered consciousness, especially in hemorrhagic strokes. Sudden loss of balance or coordination leading to dizziness, stumbling, or difficulty walking. And sudden confusion or trouble understanding others. If you or a loved one experience any of these symptoms, even just one, do not hesitate. Call 911. These are your body's alarm bells signaling an emergency. Actions to take in the first 10 minutes when a stroke occurs. Now that we've identified the signs, what exactly should you do in those crucial first 10 minutes when you suspect someone is having a stroke? Remember, staying calm and acting swiftly are paramount to saving a life. Let's walk through each step together. Step 1. Call 911 immediately. 2 minutes. This is the most important and non-negotiable action. The moment you suspect a stroke, call 911. Do not attempt to drive the person to the hospital yourself. Do not call your family doctor first for advice. Do not wait to see if the symptoms go away on their own. Why must we call 911? Because an ambulance is more than just transportation. Paramedics and EMTs in the ambulance are highly trained in emergency medical care. They can provide immediate medical attention en route to the hospital. They can begin assessing the patient's condition, stabilize vital signs, and critically, they can pre-notify the hospital. This allows the hospital's medical team to be ready and waiting, preparing imaging rooms, labs, and specialized personnel, significantly reducing the precious time it takes to initiate treatment. When you call 911, the dispatcher will ask you for some vital information. Be prepared to provide it clearly and calmly. First, the exact location of the patient. Provide the full address, apartment number, floor, and any distinctive landmarks that will help the ambulance find them quickly, such as the blue house at the end of the cul-de-sac. Second, the symptoms you are observing. Describe clearly the fast signs you've noticed. For example, my grandmother's face is drooping on one side and she can't speak clearly. Third, and this is extremely important information for the doctors, is the time symptoms began. Be as precise as possible. For example, I noticed he started slurring his words around 7 a.m. this morning. What? If you don't know the exact time of symptom onset, for instance, if the patient woke up with symptoms, state, "The last time I saw him normal was at 6 p.m. last night." This is known as the last known well time and plays a crucial role in determining available treatment options. Fourth, the patient's age and any known medical conditions. For example, my aunt is 80 years old. She has a history of high blood pressure and diabetes, and she had a mini stroke 2 years ago. Finally, your name and phone number, so the dispatcher can call you back if needed. Keep the phone line open and follow the dispatcher's instructions. They may guide you on how to keep the patient safe while waiting for the ambulance. Do not hang up until they tell you to. Step 2. Keep the patient safe and comfortable. 2. 8 minutes. While waiting for the ambulance to arrive, which usually takes a few minutes, take the following steps to ensure the person's safety. Your calm demeanor will help reassure them. First, gently help the patient lie down or sit in a comfortable and safe position. If they are standing or walking, gently guide them to lie down on the floor or sit in a sturdy supported chair to prevent falls and further injury. This also reduces the risk of falling if they suddenly lose balance or consciousness. If they are lying down, gently place a pillow or folded blanket under their head to slightly elevate it. This position can help reduce pressure in the brain. Second, loosen any tight clothing around their neck, chest, or waist to ensure they can breathe easily and blood circulation isn't restricted. This means untying a tie, unbuttoning a collar, or loosening a belt. Third, check their airway and breathing. If the person is unconscious, check their mouth for any foreign objects that could obstruct their airway, such as loose dentures, chewing gum, or food. If they vomit, gently roll them onto their side into the recovery position. This position helps prevent vomit from entering the lungs, which could cause aspiration pneumonia, a dangerous complication. Keep their head and neck aligned as you roll them. Fourth, a critically important rule: do not give them anything to eat or drink. This is absolutely paramount. A person having a stroke may have difficulty swallowing a condition called dysphagia, and giving them anything to eat or drink could lead to food or liquid entering their lungs, causing aspiration pneumonia, a very dangerous complication that can be fatal or prolong recovery. Even a small sip of water can pose a risk. Fifth, similar to the above, do not give aspirin or any other medications unless directly instructed by medical personnel. While aspirin is often recommended for heart attacks because it thins the blood in the case of a stroke, it can worsen a hemorrhagic bleeding stroke. Only medical professionals can determine the type of stroke and what medications are safe to administer. Do not self-administer any medications, even if they are prescription drugs the patient usually takes. Finally, during this phase, stay calm and reassure the patient. A person having a stroke may be frightened, confused, or disoriented by what is happening to them. Speak to them in a calm, reassuring tone. Explain that you have called for help and that paramedics are on their way. Even if they cannot respond or seem to understand, they may still be able to hear you. Your calm voice can help alleviate their anxiety. This is especially important for older adults who may be more prone to panic in urgent and unexpected situations. Step 3. Prepare information for medical personnel. 8 to 10 minutes. When the ambulance arrives, paramedics will need information quickly to make informed decisions and initiate effective treatment. In these remaining minutes, if possible, gather the following information to have ready for them. First, the list of medications. Make a list of all medications the patient is currently taking, including prescription drugs, over-the-counter medications, vitamins, and supplements. If possible, have the actual medication bottles or a clearly written list readily available. This is crucial because some medications, such as blood thinners, can influence the stroke treatments they can receive. Second, their medical history. Does the patient have any known medical conditions such as high blood pressure, diabetes, heart disease, high cholesterol, or have they had a previous stroke or transient ischemic attack, TIA? Any surgeries or allergies should also be mentioned. A health journal or personal medical history document would be incredibly useful in this situation. Third, and again I emphasize its importance, is the last known well time, LKW. Reiterate the exact time you observed the person's symptoms begin, or the last time you saw them completely normal without any symptoms. This is a critical piece of information that helps doctors determine if they qualify for specific time-sensitive treatments like TPA. For example, my grandmother went to bed fine at 9 p.m. last night, but I found her unable to speak this morning at 7 a.m. This tells the doctors that the stroke likely occurred somewhere within that time frame. Finally, if possible, have the contact information for their family doctor or any specialists the patient sees regularly. This helps the hospital medical team to contact them for more detailed information about the patient's medical background. By taking these steps quickly and effectively, you are maximizing the chances of survival and recovery for your loved one. Remember these crucial actions. Call 911. Immediately keep the patient safe. Do not give anything to eat or drink, or any medications. Stay calm and prepare information. Understanding stroke types and hospital diagnosis. Once the ambulance arrives and transports the patient to the hospital, the actual treatment journey begins. The very first thing doctors will do is determine the type of stroke. This is a critical step because the treatment approach differs significantly for each type, and accurate identification is a prerequisite for effective therapy. There are three main types of stroke we need to be aware of. 1. Ischemic stroke. This is the most common type of stroke, accounting for approximately 87% of all cases. It occurs when a blood vessel supplying blood to the brain becomes blocked by a blood clot. This clot can form directly within an artery in the brain, which is called a thrombus, or it can travel from elsewhere in the body, often from the heart or the carotid arteries in the neck, in which case it's called an embolus. When blood flow is obstructed, brain cells in that area begin to die due to a lack of oxygen and essential nutrients. 2. Hemorrhagic stroke. This type is less common but often more severe and carries a higher mortality rate. It occurs when a blood vessel in the brain ruptures, causing bleeding into or around the brain. The leaked blood puts pressure on the surrounding brain tissue, causing damage and cell death. Hemorrhagic strokes are often associated with uncontrolled high blood pressure, an aneurysm, a weak spot in a blood vessel wall that bulges out and can rupture, or an arteriovenous malformation, AVM, an abnormal tangle of blood vessels in the brain. 3. Transient ischemic attack, TIA, also known as a mini-stroke or warning stroke. A TIA occurs when blood flow to the brain is temporarily interrupted, usually by a small blood clot that briefly blocks an artery and then dissolves. The symptoms are similar to a full-blown stroke, but typically last only a few minutes and do not cause permanent brain damage. However, a TIA is a serious warning sign that you are at a significantly higher risk of experiencing a full stroke in the near future. Many people unfortunately ignore their TIAs and later face a more severe stroke. If you experience TIA symptoms, treat it as an emergency and seek immediate medical attention for evaluation and prevention planning. Never ignore a TIA. The diagnosis process at the hospital. Upon arrival at the hospital, the patient will be immediately directed to the emergency room and given top priority, often under what is called a stroke code. First, a clinical examination and medical history review will be performed. Doctors will quickly assess the patient's neurological symptoms, including their ability to speak, move, and their level of consciousness. They will also ask you or anyone accompanying the patient about the time of symptom onset and their medical history. This is where all the information you prepared earlier becomes invaluable. Second, and this is the most critical test for determining the type of stroke, is a CT scan or MRI of the brain. A CT scan. Computed tomography is the fastest method and typically the first test performed. It can immediately detect bleeding in the brain. Hemorrhagic stroke. This is crucial because if there's bleeding, administering clot-busting drugs like TPA is contraindicated. However, a CT scan may not show an ischemic stroke in the first few hours. An MRI, magnetic resonance imaging, can provide more detailed images of the brain and may detect an ischemic stroke earlier than a CT scan. However, it takes longer to perform and is not always immediately available in all emergency departments. Additionally, doctors will conduct other tests to gain a comprehensive understanding of the patient's condition and potential stroke causes. This includes blood tests to check blood sugar levels. High blood sugar can mimic stroke symptoms or worsen the condition blood clotting function important for TPA administration, and other factors. An electrocardiogram, ECG or EKG, will be performed to check for heart problems, particularly atrial fibrillation, which can lead to blood clots traveling to the brain. A carotid ultrasound may also be done to check for narrowing of the large arteries in the neck, as this is a common cause of ischemic stroke. Stroke treatment options. Once the diagnosis is confirmed, doctors will formulate a treatment plan. Remember, speed remains the critical factor, and the choice of treatment heavily depends on the type of stroke and the time elapsed since symptom onset. 1. Treatment for ischemic stroke. A. Tissue, plasminogen. Activator, TPA. This is the gold standard treatment for acute ischemic stroke. TPA is a powerful medication administered intravenously to dissolve the blood clot that is obstructing blood flow to the brain. When used within the appropriate time window, TPA can restore blood flow, prevent further brain damage, and significantly improve the patient's recovery outcomes. However, as previously mentioned, there's a strict time window for TPA administration, typically within 3 to 4.5 hours of symptom onset. Administering it beyond this time can increase the risk of bleeding in the brain, a severe complication that can be life-threatening. That's why the last known well time is so crucial, as it helps doctors determine if the patient is a candidate for TPA. B. Mechanical thrombectomy. In some cases, particularly when a large blood clot is present in a major brain artery, or when a patient is not a candidate for TPA, doctors may perform a mechanical thrombectomy. This is a specialized procedure where a tiny catheter, a thin tube, is threaded from an artery in the groin through the vascular system and up into the brain. Once at the clot's location, a specialized device like a stent retriever is used to capture and remove the blood clot. This procedure can be performed within a wider time window, typically up to 6 hours, and in very select cases even up to 24 hours, depending on individual patient factors and brain imaging that suggests salvageable brain tissue. However, performing it as early as possible yields the best results. 2. Treatment for hemorrhagic stroke. Treatment for hemorrhagic stroke differs significantly from ischemic stroke, as the primary goals are to control the bleeding, reduce pressure within the brain, and manage symptoms. Blood pressure control. One of the first priorities is to immediately lower blood pressure and keep it tightly controlled with medication to prevent further bleeding and reduce pressure on the brain tissue. Surgery. If the bleeding is caused by a ruptured aneurysm or an arteriovenous malformation, doctors may perform surgery to clip or remove the source of the bleeding. This might involve open brain surgery, craniotomy, to directly access the compromised blood vessel, or less invasive procedures like endovascular coiling, where a catheter is used to deploy tiny metallic coils into the aneurysm to seal it off. Medications. Various medications may be given to reduce brain swelling or to prevent vasospasm, a common complication after hemorrhagic stroke, where blood vessels narrow, further restricting blood flow. 3. General supportive care. Regardless of the type of stroke, patients will receive general supportive care in the hospital, often in an intensive care unit, ICU, or a specialized stroke unit. This care includes close monitoring of vital signs such as blood pressure, heart rate, breathing, and oxygen levels, managing blood sugar and body temperature, and preventing complications like infections, e.g. pneumonia, blood clots in the legs, deep vein thrombosis, or pressure sores from prolonged immobility. Maintaining a stable and safe environment is crucial for the brain to begin its healing process. Stroke risk factors and prevention, especially for older adults. The best way to deal with a stroke is to prevent it from happening in the first place. While we cannot change some risk factors, there is a great deal we can do to significantly reduce our risk. This section is incredibly important for our older adult viewers who are at a higher inherent risk. A. Non-modifiable risk factors. These are factors beyond our control, but recognizing them helps us be more proactive in managing other modifiable factors. 1. Age. The risk of stroke significantly increases with age. While strokes can occur at any age, the vast majority of strokes occur in people over 65. This is a biological reality, and it underscores the importance of diligent health management as we age. 2. Family history. If your parents, grandparents, or siblings have had a stroke or TIA, your risk may be higher. This suggests a genetic component in some stroke cases, though sometimes it's also due to shared lifestyle and environmental factors within families. 3. Gender. Generally, men have a higher risk of stroke at younger ages, but women have a higher risk of stroke in older age and are more likely to die from a stroke than men. This may be related to women's higher average life expectancy, as well as hormonal factors related to pregnancy, childbirth, and menopause. 4. Race and ethnicity. African Americans have almost double the risk of stroke compared to white Americans, partly due to a higher prevalence of risk factors, such as high blood pressure, diabetes, and sickle cell anemia. Hispanic Americans and Native Americans also face higher risks compared to non-Hispanic white Americans. These disparities are often linked to a combination of genetic factors, socioeconomic factors, and access to healthcare services. 5. Previous stroke or TIA. If you have had a prior stroke or TIA, your risk of recurrent stroke increases significantly. This is one of the strongest risk factors. Therefore, strict adherence to secondary prevention measures after a first stroke is paramount. B. Modifiable risk factors and how to prevent them. These are the factors we can control and change through lifestyle choices and medical management. This is where you can truly make a substantial difference in your health. 1. High blood pressure, hypertension. This is the #1 treatable risk factor for stroke. High blood pressure weakens blood vessels throughout the body, including those in the brain, making them more prone to rupture or blockage. Uncontrolled hypertension can silently damage arteries over many years without obvious symptoms. Prevention. It's crucial to monitor your blood pressure regularly at home and during doctor's visits. Implement lifestyle changes such as reducing salt intake in your diet, increasing fruits and vegetables, and limiting processed foods. Regular moderate physical activity is also highly effective. And most importantly, take blood pressure medications exactly as prescribed by your doctor. Do not skip doses or stop taking them on your own. 2. Heart disease conditions like atrial fibrillation. AFib, a type of irregular heartbeat and very common in older adults. Coronary artery disease, narrowing of the heart's arteries, and heart failure all increase stroke risk. AFib is particularly dangerous because it can cause blood clots to form in the heart, which can then travel to the brain and cause an ischemic stroke. Prevention. If you have heart disease, work closely with your doctor to manage it. For AFib, treatment with medication or procedures can help control heart rhythm and reduce clot risk. Managing cholesterol through diet and medication if necessary is also vital to keeping arteries clear. Adopt a heart-healthy diet rich in fiber, low in saturated fat and cholesterol. 3. Diabetes. Uncontrolled high blood sugar can damage blood vessels throughout the body over time, making them more prone to hardening and blockages. People with diabetes have a 2 to 4 times higher risk of stroke. Prevention. Tight blood sugar control is key. Take medications or insulin as prescribed by your doctor. Adhere to a diabetic-friendly diet, focusing on whole foods and limit sugar and refined carbohydrates. Regular exercise also helps effectively manage blood sugar. 4. Smoking. Smoking is one of the strongest and most preventable risk factors for stroke. Smoking thickens the blood, damages the inner lining of blood vessels, and increases plaque buildup in arteries, atherosclerosis, all of which elevate the risk of blood clots and stroke. Prevention. Quit smoking entirely. This is one of the best things you can do for your overall health and significantly reduces your stroke risk. The risk starts to decrease almost immediately after quitting. 5. Obesity and physical inactivity. Being overweight or obese, especially having excess abdominal fat, is strongly linked to high blood pressure, diabetes, and high cholesterol, all proven stroke risk factors. A sedentary lifestyle also directly increases stroke risk even if you are at a healthy weight. Prevention. Maintain a healthy weight through a balanced diet and regular exercise. Aim for at least 150 minutes of moderate intensity physical activity each week. You don't need to run a marathon. Brisk walking, swimming, gardening, dancing. Find something you enjoy and stick with it. 6. Unhealthy diet. A diet high in saturated fat, trans fat, cholesterol, sodium, salt, and sugar can contribute to other risk factors like high blood pressure, high cholesterol, and obesity. Prevention. Focus on a heart-healthy diet, such as the Mediterranean diet. This diet emphasizes fruits, vegetables, whole grains, lean protein like fish, and skinless poultry, olive oil, and nuts. Limit processed foods, fast food, sugary drinks, and processed red meats. 7. Excessive alcohol consumption. Drinking too much alcohol can raise blood pressure and increase stroke risk. It can also lead to heart rhythm problems like atrial fibrillation. Prevention. Consume alcohol in moderation, up to 1 drink per day for women, 2 drinks for men, or abstain completely. 8. Sleep apnea. This sleep disorder where breathing repeatedly stops and starts during sleep can raise blood pressure and increase stroke risk. Many people don't even realize they have this condition. Prevention. If you snore loudly, frequently wake up gasping for air, or feel excessively tired during the day despite adequate sleep, talk to your doctor for diagnosis and treatment, e.g. CPAP machine. It is crucial to work closely with your doctor to manage these risk factors. Schedule regular health checkups, adhere to medical instructions, and make healthy lifestyle choices. Prevention is truly the best defense against stroke, stroke recovery, and living with stroke. The journey after a stroke doesn't end when the patient leaves the hospital. It's often a long path of recovery, relearning, and adaptation. The recovery process is unique for each individual depending on the extent and location of brain damage, but there are common aspects we need to understand to support a loved one or ourselves. 1. Rehabilitation. Rehabilitation is a vital and indispensable part of stroke recovery. It begins early, as soon as the patient is medically stable, often in the hospital, and continues in specialized rehabilitation centers at home or through outpatient therapy. A multidisciplinary team, including physiatrists, rehabilitation doctors, physical therapists, occupational therapists, speech-language pathologists, and sometimes psychologists, will work together to maximize recovery. A. Physical therapy. PT focuses on improving strength, balance, coordination, and mobility. Patients will relearn how to walk, use affected limbs, and perform exercises to regain muscle strength and movement. Exercises might include walking drills, sit-to-stand exercises, light weights or resistance bands, and balance training. B. Occupational therapy. OT helps patients relearn how to perform daily activities. ADLs that we often take for granted, such as dressing, bathing, eating, personal hygiene, and household tasks. Therapists can also recommend assistive devices or home modifications to help patients become more independent, such as installing grab bars in the bathroom, using specialized eating utensils, or adjusting chair heights. C. Speech-language pathology. SLP. If the stroke affects the ability to speak, understand language, aphasia, or swallow dysphagia, SLP will provide assistance. They will work with patients to improve communication skills, from clearer articulation and word finding to understanding spoken language. For swallowing difficulties, they will teach safe swallowing techniques and recommend food and drink textures that are easier to manage to prevent aspiration. D. Cognitive therapy. A stroke can impact memory, attention span, problem-solving, planning, and other cognitive functions. Cognitive therapists use exercises, games, and strategies to help patients improve or compensate for these deficits, helping them return to daily life more effectively. 2. Medication management and complications. After a stroke, patients often need to take several medications to prevent recurrent strokes and manage related risk factors. This may include antiplatelet or anticoagulant medications to prevent blood clots, blood pressure medications to control hypertension, cholesterol, lowering drugs to manage blood lipids, and diabetes medications if applicable. Strict adherence to the medication regimen is extremely important for reducing the risk of recurrence. Additionally, stroke survivors may face complications such as depression, anxiety, chronic pain, muscle spasticity, a condition where muscles become stiff and uncontrollably contract, or seizures. Treating and managing these complications is also an essential part of the recovery process and requires the involvement of specialized healthcare professionals. 3. Emotional and psychological support. A stroke not only affects the body, but also profoundly impacts mental and emotional well-being. Many stroke survivors experience depression, anxiety, mood swings, or difficulty controlling emotions, e.g., crying or laughing inappropriately. Feelings of loss, frustration, and isolation are very common. Seek professional help. Psychotherapy or counseling with a mental health professional can be very beneficial to help patients cope with these emotional changes and develop healthy coping strategies. Join support groups. Meeting others who have experienced a stroke can provide empathy, understanding, and a sense of not being alone. Support groups for both stroke survivors and caregivers are available and can offer invaluable networks of support. 4. The caregiver's role. Caregivers, often family members, play an incredibly vital role in the patient's recovery process. This is a challenging yet deeply rewarding endeavor. Seek support for yourself. Caring for someone after a stroke can lead to significant stress and physical and emotional burnout. Don't hesitate to seek help from friends, other family members, or caregiver support services within your community. Make time for yourself to rest and recharge. Educate yourself. Understanding stroke, its potential complications, and the recovery process will empower you to better support your loved one and make informed decisions. Communicate clearly. Maintain regular communication with the medical team. Ask questions and keep notes of important information. You are a crucial link between the patient and their healthcare providers. 5. Long-term lifestyle adjustments. Living with a stroke requires sustained lifestyle changes, not only to prevent recurrence, but also to optimize overall health and quality of life. Continue healthy habits. Maintain a balanced diet. Engage in regular physical activity. Refrain from smoking and limit alcohol consumption. These habits are not only good for stroke prevention, but also improve cardiovascular health and overall well-being. Regular follow-ups. Adhere to appointments with doctors and rehabilitation specialists to monitor health, manage risk factors, and adjust treatment or rehabilitation plans as needed. Adapt to changes. Learn to use assistive devices if necessary. Wheelchairs, canes, walkers, eating aids, and adapt your home for better accessibility and safety. Adaptation is key to maintaining independence and quality of life. Things to avoid and common mistakes. While we've discussed what to do, it's equally important to know what to avoid when facing a stroke, especially for older adults, where misconceptions and delays can lead to severe and irreversible consequences. 1. Do not ignore symptoms, even if they are minor or transient. This is the most common and dangerous mistake. Many people, especially older adults, tend to dismiss stroke symptoms, attributing them to just old age, fatigue, lack of sleep, or common dizziness. Even a TIA, transient ischemic attack, with symptoms lasting only a few minutes and resolving on their own, is a serious warning sign and should be treated as a medical emergency. Never dismiss a suspected stroke symptom. It's always better to get it checked out and find nothing than to miss a golden opportunity. 2. Do not drive yourself or have someone drive you to the hospital. As repeatedly stated, calling 911 is the top priority. Driving yourself or having someone else drive you is not only dangerous for the patient and other motorists, but more importantly, it wastes precious time that the ambulance could use to initiate immediate diagnosis and treatment en route to the hospital and pre-notify the hospital. Every minute is valuable. 3. Do not give the patient anything to eat or drink. Repeating this due to its critical importance, the risk of choking and aspiration pneumonia is very high in stroke patients. Their swallowing mechanism might be impaired without you realizing it. Do not attempt to force the patient to drink water or eat anything, including medication. 4. Do not give aspirin unless instructed by medical personnel. While aspirin is a common and useful medication in many contexts, it is a blood thinner and can worsen a hemorrhagic bleeding in the brain stroke if that is the type of stroke the patient is experiencing. Only give aspirin if medical personnel have confirmed the type of stroke and specifically instructed you to do so. 5. Do not sleep off symptoms. If you wake up with stroke symptoms, or if you observe your loved one experiencing symptoms before going to bed, and they are still present upon waking, report the last known well time to medical personnel. Do not assume things will get better after a night's sleep. Many strokes are discovered in the morning, and knowing the last time the patient was well is crucial for determining treatment options. 6. Do not delay calling 911 due to fear of bothering someone or uncertainty. Healthcare professionals would rather you make an unnecessary call that later turns out not to be a stroke than miss a real stroke case. In emergency medicine, caution is always preferred. Do not let your uncertainty lead to a potentially dangerous delay. 7. Do not believe in unproven home remedies. There are many myths and anecdotal cures for stroke circulating, such as pricking fingertips to draw blood or administering unverified herbal remedies. These are not only ineffective but also waste valuable time and can cause further harm to the patient, leading to infection or other complications. A stroke is a medical emergency that requires professional medical intervention at a hospital. There is no folk remedy that can cure a stroke. 8. Do not ignore a TIA. Once again, remember that a transient ischemic attack TIA is a serious warning sign. If you or a loved one experience fleeting stroke-like symptoms, do not dismiss it. Seek immediate medical attention for evaluation and prevention planning to avert a full-blown stroke. Conclusion and call to action. We've covered a substantial amount of information today, and I hope that you are now equipped with valuable knowledge to protect yourself and your loved ones from stroke. This is a complex topic, but with basic understanding and swift action, you can make a profound difference. Please remember these core takeaways we've discussed. First, memorize the FAST acronym. Face drooping arm weakness, speech difficulty, time to call 911. This is the key to quickly recognizing a stroke. Second, act immediately. Do not wait. Do not hesitate when you recognize the signs. The sooner 911 is called, the higher the chance of recovery. Always remember that time is brain. Third, understand that time is brain. Every minute that passes after a stroke is valuable, and timely arrival at the hospital can determine whether a patient qualifies for life-saving treatments. Fourth, managing risk factors is key to prevention. This is the best way to prevent a stroke from happening in the first place. Work with your doctor to manage high blood pressure, diabetes, cholesterol, and other health conditions. Regular health checkups are indispensable. Fifth, maintain a healthy lifestyle. A balanced diet, regular physical activity, not smoking, and limiting alcohol are the cornerstones of good health and the most effective stroke prevention measures. Finally, be prepared for the recovery journey. If a stroke does occur, rehabilitation is essential to regain function and quality of life. Be patient, persistent, and seek the necessary support. For more information and support, I encourage you to visit reliable resources such as the American Stroke Association and the American Heart Association. These organizations offer a wealth of resources, from detailed educational materials to support groups for both stroke survivors and caregivers. They also have educational programs and printed materials you can consult. Stroke is a formidable adversary, but we are not powerless. By raising awareness, equipping ourselves with knowledge, and acting swiftly, we can mitigate its impact and save lives. Let's turn this knowledge into your power. If you found this video helpful, please hit the like button, share it with your loved ones, and subscribe to our channel so you don't miss out on other vital health information. Knowledge is power, and together let's make our community safer and healthier. Thank you for spending your time with us today. Take care of yourselves and those around you. We'll see you in the next program.